You're listening to the Tooth Sleuth Podcast, all about the business of dentistry, hosted by yours truly, Greg Essenmacher, a fixed full arch dental expert and founder of G&A Consult, speaking with industry leaders on the dental landscape from their perspective. At G&A, we specialize in transforming full arch dental practices, teaching, coaching, and training teams to deliver an exceptional patient experience, from that first call to delivering final smiles. Whether you're a practice owner, a DSO executive, or a regional leader looking to expand your full arch program, boost same-store sales, or unlock the true profitability of full arch cases, we've got you covered. Ready to see how full arch can elevate your practice? Visit the show page or book a discovery call today. Let's turn your potential into results. Welcome back, everyone. Tooth Sleuth Podcast. Greg Essenmacher, your host. I hope you know me, but if you don't, like, share, subscribe. What else can they do, Anjuli? I don't know. You know this podcast thing. Your guests all over the place. Everybody knows. My guest today, Anjuli Avis. I'm so excited to have you on the show today. Anjuli, introduce yourself to my listening audience.
Oh, I'm so happy to be here with you. I'm Anjuli Avis, RDH. I've been a hygienist for 20 years in this crazy industry, 25. So I'm so happy to be on with you today.
And thank you for saying Anjuli. I said it wrong in the beginning. Blow me up on socials. Greg, you should always check the name and the pronunciation of your guests before you start spouting things off. And that's what I did. See there? Already
You're
making
forgiven.
mistakes. Not mistakes, learning opportunities. Words matter, don't they, Anjuli?
Yes, they
Wouldn't you
do.
say? Yeah,
Absolutely.
they really do. Well, tell me about your journey in dentistry. 24 years you've been in dentistry?
Yes. Let's do the crash course. My dad's best friend was a dentist. So there you go. He said, Anjuli, I think you need to be a hygienist. I think you need to be a hygienist. Because he knew I didn't want to be a dentist. No offense to dentists, but he just knew. He kind of was like, Anjuli, this is the thing for you. I really think it is. And from there, I assisted with him, did some assisting, shadowed, then went to hygiene school. And that's kind of the history.
Nice. So from hygiene school to how I know you, which is not as a hygienist, right? So talk to me about what was that initial scratching of the itch? What got you inspired to do something more than being a hygienist? Not that there's anything wrong with being a hygienist,
Of
but
course.
you almost have like this larger than life, right? I first learned of you on LinkedIn and then getting to know you. So tell me a little bit about that. What was the first inspiration of doing more than just helping people to have good hygiene, oral hygiene?
So the first decade of my career, I was a temp. And I think that led me to see exposed me to a lot of different parts of dentistry, ideologies, vendors, all kinds of things, because I wasn't in one spot. Um, I've had the opportunity after doing a little bit of non-clinical work with one of the doctors that I worked with. Um, I got an opportunity to be an operations manager with the Yankees team dentist. And that was like, wow, it was a big beast of a practice. They do amazing work. Um, but in-house lab, coordinating with all the specialists, that was my first taste of, wow, we can do so much more for patients outside of the clinic, which I still love to see patients when I can. I love the clinic. I do miss it sometimes, not doing it full time, but I saw, wow, we can really make an impact, not just with patients, but with each other. We can really help each other grow. And so I think for me, that was the taste. And they also did continuing education seminars, teaching technique on beautiful dentistry and seeing teams grow, see that they could do better. I think that was my first taste of there's more out there outside of the clinic that I could be helping, not just patients, but my colleagues as well.
And so if I have the math right, so this is more than a decade ago that you really got this experience to be an ops manager, right, for this particular group. So talk to me a little bit about what have you seen evolved in gaps of learning between the relationships of teams of 10, 15 years ago compared to today? Has it changed at all, or are there still some themes that are common from then to now?
So between teams, I think now we are seeing more communication. I think there is, there's an argument that, oh, dentists and hygienists are just not getting along. I think that's something that we'll always have to work on. But I do feel that there is a lot more partnership happening. Whether it's in DSO space, whether it's in the private practice space, we're getting a lot of new coaching that's coming around saying, hey, we have to work on this together. This is a partnership. So I do think that specific partnership of providers is getting better and has gotten better. Dentists seeing hygienists as providers. I was very fortunate to work with doctors who had that ideology already, and then really, really seeded it with their associates, with others that they talked to, and when they mentored others. So I do think that has gotten a lot better. That's been a big change.
Yeah, communication being the key for sure. And I know in our lane at G&A Consult, we work, in the implant and the full arch lane. And when you're dealing in that specific space, there's so much need for, I don't want to say education for hygienists, right? But awareness around maintenance of implants. And then the education as well for dentists, right? The right tooling in order to preserve these implants for long term, right? Not talking about lifetime, that implants will last for a lifetime. Well, if you maintain them well, right? And being able to have that communication piece back and forth, not just a traditional hygiene appointment for a new patient for natural teeth. And so, what have you seen as far as that goes about tooling and the necessity of tooling, especially with your experience the first 10 years of being a temp? Because I don't come from operations. I don't come from that side. My 18 years in dental, it was the first 14 was, on the manufacturing side, right, for a biologics company and then an implant company, and the last 4 of being the CEO and founder of G&A Consult. So I have a different perspective on things. So I'd love to hear yours on that particular topic.
Well, I think too, now that providers, and not, I wouldn't say just hygienists, I think also assistants, they're giving them a lot of leeway to have these conversations with patients on care.
Mm.
And if to your point, maybe specifically about implants, hey, there's a responsibility here. We adopt this patient, not just the dentist, the hygienist does, the assistant does, the office manager does. We have adopted this patient because once a patient goes on this implant journey, it is a journey. It's a lifetime journey. It's not a one and done, you know.
Sure.
So I think I have seen that switch as well of, yes, these are the doctor's patients. These are our patients. So, hygienist, what are we looking for when a patient is new? Are we doing that patient interview? Do we see the missing teeth? Are our assistants having these conversations? Are we letting them? Are we letting them? Because they can have these. They can. It's proven that the patient trusts dental assistants over everybody. They're the number one people that patients trust in the dental office, and then the communication with the office manager. So I have seen that change a lot from shifting to this is just a doctor patient, especially when we have complex cases like implants, to this is an adopted family member that we're going to be on a journey with for a long time. So we have to keep up with them. And really, again, like you said, it's not education, it's allowing them to be a part of their full-time, long-term treatment plan.
I mean, there's so much to unpack there with what you just said. You like lit up a whole bunch of my brain synapses. So I love that. And I knew, Anjuli, why I wanted to bring you on. When you talk about adoption of patients, and I immediately start to think of full arch and some of these full arch clinics, like I think of Clear Choice, I think of Nuvia, where they're doing the procedures and then, oh, you've got your arch, on you go. And who's doing the maintenance of these arches? Right? Because then they end up in a general dentistry practice and, oh, great, now take care of these arches when the procedure wasn't done there. And so, literally, adoption of that patient and ownership of that patient and maintaining those hybrids. And trust me when I say this, right? And this might be a little controversial, but hello, like, what are we doing as far as educating in general? Right? The 160, 200,000 general dentists and their hygienists on how to take care of these hybrids, right? So it is an investment of a lifetime because most of the patients getting a full arch, a fixed full arch, they probably weren't in the best oral health condition to begin with. So what is their maintenance pro? You think they're going to be really good with health maintenance now with that investment? I mean, come on, wake up, public. But that's the first thing that, I mean, right? Right? I heard you laugh, right? Are you with me on this one?
There's a reprogramming that has to happen in the office. And again, when I was working in full restorative, we did hybrids, we did, crown, everything. I mean, everything you could do to restore a complete mouth. We did everything. So it was a reprogramming of them. And our patients that had dentistry last the longest, they were the ones that we reprogrammed them first before we touched them. And that again was done by not just the dentist, it was done by the hygienist and was done by the assistant office manager. So there's a reprogramming that has to be done, and we have to take that on. Like, we have to own that. Say, I'm not going to put this patient into treatment until we have reprogrammed them to understand that this care and their hygiene, their maintenance of their overall health has to change. I have seen such a great change in what's available to hygienists and assistants instrumentation wise. Just saying, hey, you know what? You haven't had the right instrumentation available to you to make sure when they come in for their maintenance that you can actually do a pretty good job here. You know, you can get under there if the appliance is not being removed, doing what we can. So that's changed too. I anything from ideology to instrumentation has come a long way. And as a hygienist who used to use just the plastic instruments, now we're seeing, oh my gosh, I have this plethora of instrumentation that I can use for an implant case is exciting too. So that's another aspect.
Yeah, and I love that you use the word reprogramming, right? Of the patients that are coming in, especially if they're making this kind of investment into, that brand new smile that they're trying to create, right? From, a very desperate situation. And it's really about the onus is on the practices themselves to the responsibility to respond with ability to the situation they're in and not just be looking at them as a dollar sign. And so I love that you shared that. The other piece that was coming up from what you'd shared a little bit earlier, and you touched on it there as well, is that patients trust the dental assistants most. And with practices that we work with all over North America, as we talk about this, that the doctors tend to be at this elevated level because they have doctor in front of their name, and the patients will turn to the dental assistants inevitably. The doctor walks out of the room. Do I really need that?
Yeah.
What do you think about that? Right? Because it's like layperson to layperson, right? And so that's why when we work with clients, we call it the 360, right? It's working with everybody in the practice. It's not just making sure the digital marketing matches what the person on the phone sounds like, matches what it's like at the front desk, matches what everybody's got to be speaking the same language, and they all have to be trained differently, but there has to be cohesiveness with what they're using, the language they're using, what they're calling something. A great example is, if you're going to call it a CBCT in your marketing materials, please call it a CBCT all the way through. If
Yeah.
not a
The tribal
CBCT, cone
language.
beam, digital
Yes.
record, CT scan, by the time the patient gets done with everything, they don't know what
Mhm.
the heck happened to them or what it was, and they're thoroughly confused. I call it a microfracture of trust. And
Yeah.
by the time you get to the point where you're trying to share with them the treatment that you're recommending and why, they're saying no, they don't know why. Subconsciously, they're confused, right? It's a lot of information. And so,
Yeah.
and you were agreeing with me there. So have you seen that as well?
Yes.
And I know you
So
do some work with clients as well in the same way.
it's, in when coaching, it's one of those things that teaching tribal language. Tribal language, everybody says the same thing. Now, what we don't understand is just because we're talking about the same thing, if we don't refer to it as the same thing, just like you said, patient gets confused and it's caused friction. I don't know if you read the book, The Convenience Revolution. I love that book. It's great, by the way. And it's number one reason why consumers will walk away or purchase is the level of friction. Once patients are confused, then they lose trust because there's a whole level of friction. They're like, I don't want to deal with this. So are we causing friction or are we reducing friction by having tribal language or not having tribal language? And that's in any case, whether it's implants, could anything from implants to getting a patient to agree to financing, anything.
Yeah, I love that. And thank you for referencing that book. I know when I put up on LinkedIn fairly recently, you suggested 4 books, and the first one I grabbed was one of yours, and I digested it very quickly and like have gone through others. You're like, I don't know, you probably read all these. And I think it was a picture you took like with the 4 books on your bedstand on your bed. And I thought,
Yeah, they stay there.
that's why I like you. It's like, keep them there for sure. Well, and you'd mentioned in the very beginning and the top of the program about, you had the opportunity in the first 10 years of you being a hygienist, temping, that you had an opportunity to meet with a lot of vendors and get exposed to a lot of systems and processes and philosophies. And so I want to transition now to talk a little bit about relationship with vendors, because I know that you've got something brand new up your sleeve, and I've been able to experience this. So I want to talk a little bit about that. So new opportunity that you're working with Smile Source, is that correct?
Correct. Yes.
I love it, and they have their big event, the Exchange, coming up, and that is in Louisville. Am I
Louisville.
saying that right? Louisville, for
Louisville.
those of us that Louisville that says it like that, Louisville coming up, and I just want to share that, for myself, and I work with 3D diagnostics, as part of what I do. I do lots of things, and we've seen a noticeable change in just having that relationship of how vendor partners, industry partners are perceived. Because at G&A Consult, we love working and partnering referrals, how those relationships evolve, right? And how clinicians and vendor partners and industry partners can relate to each other. It's so critically important. I think of the evolution of those relationships and how critically important they are. Talk to me a little bit about how you're changing relationships with industry partners, because I think that's critically important for us to start to share openly, in
Sure.
a dialogue of this nature.
I think I have to think about where I started when I was a clinician. And I think I've written about this, I've talked about how it wasn't always the case. I was a head down clinician. Let me just look at the patient, figure this out. Oh, the rep is coming in. They've got some new stuff. They got some coupons. This is great, right? Move on. I need to order some things. But when I started really talking to them, they talk about conferences. They talk about what's happening down the street. They talk about what's happening in new technology. They talk about all those things. And then I started to see, okay, there's a lot of knowledge here that I'm not really tapping into. So fast forward, kind of getting into some really good relationships with, your distributor rep or just the rep coming in, and the conversations they have with the doctors, the ones who took advantage of those relationships, I just saw a whole different world. And so kind of moving into that. And I think that we have seen that in the DSO world, obviously vendors, there's a big discussion of that because that's what makes the DSO world go around. But I think we're missing this piece also in private practice. We can utilize those reps, those partnerships just as much. And I think that could be where there's room for opportunity there, right? You're a hygienist, your assistant, your office manager, and your doctor can all have conversations with people we already have relationships with. We already have a contract with them. They already work for us. They have all this data that they're pulling. Like we're privy to that. We can ask them for that information. So that is something, like, it's a growth journey, and they're more than willing to go on it with us. But I think sometimes, again, as clinicians, we don't want to ask. We don't want to ask, or we don't want to go there. We don't think about it. But there's so much they have to offer us. And again, that's from personal experience, kind of going from clinician with that journey with them to now working kind of more side by side with them on behalf of doctors.
Well, and I appreciate you sharing your personal journey about starting out with a clinician and head down and just, give me the coupons. I've got some stuff to order from you, to starting to open up and being more open to them having, the what's happening type of situation. Because what I know to be true is that having that opportunity to be able to bring in best practices of what's being seen elsewhere. Now, granted, there are some that are just there to try to sell you stuff, right? And don't necessarily have best interest in mind, right? There are those, and that's okay. We can just set them aside. Yeah, it does. It does exist. But there, in general, I know, like at G&A Consult, a lot of what we do are really best practices that are going on all over the country. And sometimes, and you talk about silos, right? Silos in dentistry, silos in general. And so I'm going to borrow your language, if you don't mind, please, if you'll allow me,
Absolutely.
that being siloed in a practice or even in a small group, you see what you see because you're in that environment. And the blessing of having industry partners, right? Whether it's your rep or even the regional manager, or even if you get to see like a national manager who is, national or even global, is they're bringing all of these best practices from outside of your local area, your local practice, your local area, or even your local region, right? Your region, and sharing with you opportunities to expand your knowledge and really multiply what you're doing. And bring in new concepts and new ideas. And that's really where the growth can happen, not just from somebody on stage who's presenting their best possible cases and their best possible outcomes, and not they're ugly, right?
Hmm.
In addition to, other platforms like LinkedIn and Instagram and Facebook where you have to filter the information as well. And so it's really just about being a lifelong learner, like you are, like with books, like we shared just a few minutes ago. And I just so appreciate that you're willing to share in an open way that perspective. So thank you for that. I think my listening audience can definitely benefit from what you shared there.
Well, I just hope that, again, as a clinician, that it can help other clinicians to see where the challenges are and where they can fit in for the solutions. Really, that's what it's all about.
Yeah, it's a beautiful open mindset, right? And it's an abundance mindset that most of us are willing to share the knowledge that we have for those of us that do have an abundance mindset. So thank you for that. Well, Anjali, this is the point of the program. All of my guests play a little something called What the Sleuth is Going On. It's three rapid fire questions. The first thing that comes to mind, are you ready to play?
I want to say yes.
She wants to say yes, so we're going to go with that. Question number one. What's the worst bad breath you've ever encountered?
Oh gosh, that's a and then it actually makes me a little sad to answer this question. The worst one was I worked with geriatric population in when I lived in Clearwater, and that was for a couple of years. And it was a patient from the nursing home. He'd been neglected for quite some time. Oh yeah, we brush his teeth. Half the time somebody else is taking his toothbrush. They would take each other's toothbrushes, things like that, lose them. I think I had a patient who he was coming from a nursing home that was being shut down and they were being neglected. And that to me is like it's sad, but it also makes me reflect that what else can we do for that community? And that is definitely it. That was it.
Yeah, and I like that you added the perspective that sad, yes, but the what can we do for that community? I love that you have that servant leadership mindset for sure. Question number two. If you could change one thing about your smile, what would it be?
Oh, do we have all day? I can wait all day with that. Because I think we're the worst on ourselves, especially if we are like the clinicians. We're like, oh, this and this. Well, growing up, I've been through ortho 3 times as an adult. I'm currently still in my last one. So I would definitely change the size of my teeth. The what they stay pretty white, but they've never been in place. I would say a big rabbit teeth. I would change that.
Okay, so for anybody who's just listening on the audio, head over to the GNA Consult YouTube page, channel. At about the 22-minute mark, she has Anjali, you have a beautiful smile. I mean, come on. I know you're right though. Like most critical, I was just at my dentist yesterday and we were like going through and I'm like, yeah, so can we just and that and that and that and he's like, oh my gosh. And then I was reflecting, I'm like, actually, like people tell me that I have like a really nice smile. I'm like, so maybe just that and that. But like when you get like the close-ups in the inside of your mouth, you're like,
Yeah.
oh, I want to change that and that. Oh my gosh, it
Right.
looks like that. And oh my God, I have a horrible smile. Oh my gosh, I look terrible. I mean, if you ever want to feel bad about yourself, like just go to a dentist that takes all the intraoral
The
pictures
intraoral
and all
pictures.
that. Oh yeah. Oh, you look horrible. Like, yeah, like I'm an ogre. Like just lock me up and don't ever look at me. Like the masks were great during that time. Absolutely.
Get it. Get it.
Yeah, for sure. Question number three, last and final. If you could go back and be the inventor of any dental product, and no, you can't choose your own if you have one,
Okay.
which one would you choose and why?
I could be in charge of any dental product. I think how far back am I going here? No. I think it would be the invention of digital x-rays. That might be boring, but having dipped the extra x-rays, been through okay, these didn't come out, they got stuck. It really did revolutionize in the industry and how we can be more efficient. Um, I think that would be it. It just really changed how our workflows. And now we have AI and all that, but just the ability to record it, send it out. collaborate. I think that's the biggest thing, collaborating with specialists, the ability to send it out and get a group treatment plan within a couple of days because we can get this patient really, really going on the right journey. I think I would say that. Yeah.
I mean, this is just another reason why I love you so much, Anjali. I mean, you take like the answer and you talk about efficiency, my wheelhouse, and collaboration, another one of my wheelhouses. I mean, what a great answer. That was amazing. Well, Anjali, in the last few minutes, I want to respect your time and my listening audience. Is there anything I haven't asked you that you want to share with my listening audience today?
Well, I do want to share a little bit, a little more about the exchange because
Please.
for me, it is it is a community. It's not just can I get a cheaper 2x2? Can I get a cheaper, handpiece? What we have seen is at the exchanges where when people come, whether they're members or whether they're just curious, is where they see the community where together we can actually be prosperous in dentistry. Um, there's a lot of collaboration and partnership that happens there, not just with our vendors, but with each other, with the members, with the dentist to dentist. So I really would encourage anyone who has questions about the exchange to reach out, check it out, go to the website. It's going to be a really, really exciting one this year. Last year was really, really, the numbers were amazing, but I'm really excited about this one this year. So if you're curious what a community can do for private practice, check out the exchange.
Well, and I've just got to add as well, I've been to the exchange for the last 3 years, I want to say, at least the last 3 years. And I think this will be my fourth year, if I'm not mistaken. Somebody can check my count on that. It's a fun event.
Yeah.
Like the camaraderie, the energy, it's not your typical like conference or event. It's a lot of fun. It really is. It's something to check out. And I know the programming is amazing and I'll be there. So I mean, what other and I think there's gonna be puppies this year. So like how could you not want to be at the event? There's puppies.
Puppy booth. A pup.
I mean,
It's
my friend Kathleen and I talked about this like 3 years ago. I thought it was kind of jokingly that I said I'm going to bring a trench coat with puppies, and now it's happening. There's going to be puppies. So if you need a reason to check out the Smile Source Exchange, that alone should get you there. So Anjali, how can they get a hold of you? I know we'll get it in the show notes, but say it out loud in case somebody's driving or jumping on a
yes.
trampoline while they're listening to this.
So you can catch me. I'm on LinkedIn, the Hustle Hygienist on Instagram, and you can always reach out to the Smile Source website. Go to the Smile Source website, and it will connect us.
Absolutely fabulous. Anjuli Avis, my guest on the Tooth Sleuth Podcast. It has been my immense pleasure. Thank you so much for coming on the show.
You're welcome, and thank you for having me.
If you need help with converting lead calls into consultations, closing consults into more full arch cases, or creating a more strategic marketing message and branding for your practice or group, follow me for more tips or reach out to G&A Consult for a discovery call today.